All right, let's jump in. Well, good afternoon, everyone. Welcome to Agrifood Conversations, brought to you by iSelectFund, the Van Trump Report, the ULab Institute, and Family Farms Group. My name is David Yoakum. I'm an associate on the iSelectFund Ventures team. I'm excited to welcome you to our presentation and discussion today. Agrifood Conversations is all about driving innovation in food and agriculture. Each month, we highlight a specific theme, including emerging topics such as soil health, plant genetics, vertical farming, and aquaculture, to name a few. This month's theme is sugar reduction, and on today's call, we're joined by Lance Lively, COO of BioLumen. BioLumen is a nutritional technology company that's engineered a 100% natural structured super expanding fiber, which captures sugars and fats in the stomach. These form micro jelly balls that navigate unabsorbed through the small intestine so that part of these encapsulated sugars and fats can then be released inside the colon, feeding the microbiome and increasing the bacterial production of beneficial short-chain fatty acids. The remaining unabsorbed trapped nutrients are naturally excreted in a caloric elimination function. Now, each of you knows that companies are more likely to succeed with the right network of customers, talent, investors, and advisors. We've invited you to this call because you're some of the smartest and most talented people in BioLumen's market. You're potential customers for BioLumen products and services. You have built a company similar to BioLumen's, or you are a sophisticated business person or agricultural professional who understands the market and the challenges and opportunities that BioLumen may face. Now, before we get started, we have a quick poll question to get a better idea of who we have on the call today. Please take a few seconds to answer. And while we're doing that, a few process comments. We are not soliciting investment. This presentation is to provide information to help BioLumen find customers, mentors, and other strategic relationships that can help them grow their business. You are all on mute. You can use the chat window to ask a question at any time. This presentation is being recorded and will be available for replay. And so without further delay, I am pleased to introduce Lance Lively, COO of BioLumen. Lance, feel free to take it away.
Thanks so much, David. First of all, I want to thank David and iSelectFund for inviting me to speak with you all today. And I also want to thank those of you in the audience for attending this talk. As David mentioned, my name is Lance, and I'm Chief Operating Officer of BioLumen. At BioLumen, our mission is to modify health outcomes without having to change human behavior. To help motivate the core challenge that BioLumen seeks to address, let's wind back the clock 2 millennia to the time of Hippocrates. Hippocrates has purported to have said that all diseases begin in the gut. And while this is certainly a broad overstatement, modern medicine is increasingly realizing the connection between gut health and overall physiological health. A second quote that's incorrectly attributed to Hippocrates states, "Let food be thy medicine and medicine be thy food." So how does the modern human diet hold up to this lofty goal of food as medicine? The answer is terribly. It should come as no surprise to those of you in attendance that modern food is absolutely not good medicine. But why is this the case? Professor Robert Lustig, who is a BioLumen co-founder and author of New York Times bestseller Fat Chance, put it best. He states that the modern food industry has removed all of the fiber and packed in sugar. To examine this more closely, let's compare the modern diet to paleo diet. Modern foods are ultra processed. They have both natural and added sugars, but have been stripped of their fibrous content. They're highly calorically dense, and they're very quickly absorbed in the stomach and the duodenum, which feeds adipose tissue cells. In contrast, paleo foods are raw, highly fibrous, and only contain natural sugars. They are much calorically less dense and are far more slowly absorbed into the human body. So BioLumen's challenge that it seeks to address is to undo the disparity between modern diet and paleo diet. In order to accomplish this lofty goal, our nutritional technology, when ingested with modern food, gives that modern food paleo food characteristics. We've developed a proprietary blend of cellulose and hydrogel that, when ingested, expands more than 60 times in the stomach and absorbs sugars and starches that are consumed as part of one's meal. For each gram of material that is consumed with a meal, 6 grams of sugar, equivalent to 24 kilocalories, are expelled from the body. Importantly, BioLumen's materials consist of generally recognized as safe materials that provide us with a simple FDA approval pathway to reach the market. In the next slide, we've created a cartoon video demonstrating the mechanism of action for our product. BioLumen's capsule is ingested alongside a meal. While in the stomach, the capsule dissolves, releasing the constituent material, which consists of that cellulose hydrogel particles. These particles, when dispersed in the stomach, will absorb sugars and starches into the porous regions of the cellular matrix. As these materials are absorbed into the cellulose matrix, they expand 60 times their size, creating a sense of satiety or fullness within the stomach. The material then passes through the intestine, and the enzymes within the intestine are not able to digest the carbohydrates that are trapped within our particles. However, carbohydrates at the surface are able to be metabolized by beneficial bacteria, which transform these carbohydrates into short-chain fatty acids that are essential for gut health. Finally, excess sugars along with our materials are naturally passed through the digestive system, resulting in overall caloric deprivation. The images on this slide show our technology in action through an actual demonstration. The image on the left shows our particle material after it's been immersed in a solution of ice cream and has absorbed the fats and sugars from the ice cream. The image on the right shows our material magnified, where you can see the porous regions and parts of the sugars, starches, and fats that have been trapped within the dehydrated particle. To demonstrate the efficacy of BioLumen's product, we leverage an artificial stomach system known as SHIME, which is Simulator of Human Intestinal Microbial Ecosystem. The benefit of the SHIME system is that it replicates physiological conditions in an in vitro environment. As you can see from the image at the bottom, the SHIME system is broken out into different segments of the human gut: stomach, small intestine, etc. Within each of these segments of the gut, you have an in vitro system that replicates pH conditions, chemical conditions, and bacterial presence conditions unique to each segment of the gut. So using these SHIME tests, we demonstrated the following results in an in vitro environment. Starting from left to right, when our pill is first ingested and is released into the stomach, the first thing that one notices is that there's no GI discomfort, which is unusual for highly fibrous products. After our particles absorb sugars within the stomach, they then pass into the small intestine. Within the small intestine, there is a marked 35% increase in the conversion of carbohydrates into prebiotics by gut microbes. This conversion leads to the generation of essential short-chain fatty acids such as acetate, butyrate, and propionate. Finally, the particles which contain remaining sugars pass into the large intestine and are ultimately expelled from the body, resulting in a 33% reduction in calorie intake from sugar versus the control. This SHIME test was conducted with our first version of our prototype. However, in anticipation of upcoming human clinical trials, we've developed a second superior MVP that has much greater efficacy when it comes to absorbing sugars, both in isolate as well as part of more traditional food blends. Our technology platform enables us to develop a broad brand platform with many different product form factors that can address different areas of the market. For instance, we have over-the-counter pills, but there's also the potential for a micro powder or even a branded nutritional bar in order to deliver our fibrous content. And while as a startup, we're of course laser focused on initially a single product form in order to get to market, we have a lot of optionality in terms of expanding our reach to other different product form factors. The primary value driver for BioLumen's product is that it both serves as an effective weight loss agent and gut health promoter. Most products that are currently on the market either address one or the other of these issues and do so in a not particularly clinically effective manner. Because BioLumen is able to address both pillars in both markets, we have a lot of potential in the $200 billion weight loss market, as well as a lot of potential to tackle the $35 billion gut health market. Our primary initial path to market will be through direct-to-consumer channels, targeting customers who have a demonstrated high willingness to pay for a caloric deprivator and gut health promoter, as well as high demonstrated willingness to try our products. The three main categories include health-minded individuals, serial dieters who have a high propensity for trying new products, and finally, those populations who have gut-related health issues, which includes diabetes and other complications. BioLumen's technology sits on a strong foundation of IP, which helps create a competitive moat and allows us to effectively and quickly reach the market. BioLumen also benefits from an incredibly strong founding and operating team, which is helping de-risk the overall technology. Paulo Costa serves as Chief Executive Officer and is one of our co-founders, and he brings a wealth of entrepreneurial experience in the biomaterials space. Robert Lustig, as I mentioned, is a professor emeritus of pediatrics at UCSF and brings a wealth of weight loss and gut health expertise. Pablo Zamora is the co-founder of the Knot Company and brings a wealth of commercial expertise. On the research and production side, Jiaxin heads up our production efforts, while Yuhan leads our research and development efforts and has a particular expertise on biopolymers. And finally, Atusa brings a wealth of expertise in terms of polysaccharide research and development. So again, I would like to thank everyone in the audience for attending this talk, and we'd love the opportunity to connect with you. In addition to the questions that you have, please feel free at any time to reach out at the below email. And we're particularly interested in hearing from anyone who has connections or expertise in clinical trials, direct to consumer marketing, but also we're just happy to chat with anyone about anything related to the work that BioLumen's accomplishing. Thank you.
Well, Lance, certainly appreciate the presentation. Really exciting and important work you and the team are working on. So thanks for sharing it with us. At this time, we'd like to invite the audience's questions. I know that there's already a couple that have rolled in here. The Q&A box is typically the easiest place to put those. Sometimes people get confused between the chat box and the Q&A box. So we can put it all in the Q&A box. That'll be a little bit easier. And I'm going to go ahead and start with some of the questions that we have from the audience. So our first question from Chris, it is rather difficult to get people to reliably take their vitamin pills. As your materials will be dosed as a pill, how will you ensure compliance meal after meal after meal? For many people, this will be a significant behavior change.
It's an excellent point. And to be direct, this is a big consideration for whether or not a pill will be the primary form factor. Not only do you have compliance issues with pills, but you also have general pill fatigue, and it does result in some behavior change. And so even though for illustrative purposes, we talk about our product as a delivery pill, that's likely not going to be the first product form factor. And instead, the product form factor will be something that's more under the hood embedded in a food product. So that could be a nutritional bar sold through a system of gyms. It could also be an additive powder, but there are a lot of disadvantages, as the questioner mentioned, about relying on pills that do require behavior change.
Great, thanks, Lance. Another question from the audience has a little bit to do with potential, I believe, environmental impacts of the decomposition of this product once it's been passed through the human body. So if the human gut cannot digest the pill contents that capture sugar, fat, what is the impact on the environment when the undigested pill reaches sewage in nature? Will it be biodegraded naturally, or will it take decades to decompose like plastics?
It will absolutely not take decades to decompose. These are largely natural materials that are fibrous in their content, just as natural, more paleo foods are fibrous. And so because these are natural foods, there are microbes within the ecosystem that naturally decompose them, unlike plastics. And so you, as they're safely ingested through the body and pass through the sewage systems, they will be able to be remediated in a timely fashion, and downstream won't pose detrimental environmental harm.
Got it. Excellent. Another question from the audience: is the hydrogel component FDA GRAS, or generally recognized as safe, already used in food or pharma formulations?
Yes, it is. And that's a big reason why, of course, it has GRAS approval. And so a lot of the proprietary elements are, of course, the specific nature of the blend and components of hydrogel, but it is, because it's GRAS, it does have demonstrated efficacy and demonstrated market traction.
Another question, when will this be on the market, and do you need volunteers for the study?
I mean, we're always happy, even if it's just purely anecdotal, to have people try our product. We do have, at a smaller scale, product non-commercially available, but for anyone willing to potentially try. But to actually get formally onto the market, we're targeting sometime likely around mid-2021. So pretty near term.
Got it. And I'm just piggybacking on that question. I'm curious, as I'm sure people, the prospects of a product like this are super exciting for anybody who wants to reduce the way their body metabolizes sugar, and fundamentally on a health basis reduce the cost of sugar on their body. As you start to think about validation of the approach, are you thinking about ways in which you can tie in real-time monitoring or glucose monitoring in the blood to help show people that they're validating that this method is validated in real time?
It's an excellent question, and frankly, not a bad proposal. Most of our validation will come from clinical trials where that sort of work is conducted in a documented, consistent method with appropriate controls. And so to be able to make strong claims both to FDA and to market, those sorts of rigorous clinical trials are necessary. However, I think it's a great suggestion that just to help build up consumer interest and acceptance, if the data supports it, then encouraging customers to monitor their blood sugar with and without product, and just so they can tangibly see for themselves the impact.
Got it. Another question here from Steve. You mentioned calorie deprivation. Does this product affect other products besides sugars, and how does it reduce caloric intake overall?
It does. So it primarily, carbohydrates and smaller molecules are the ones that are deprived from the body. And the mechanism of action, as I mentioned before, was the cellulose hydrogel material has a porous matrix, which absorbs within that matrix the sugars and other materials and makes them non-bioavailable for digestion. And so it reduces within the stomach the amount of, and in the duodenum, the amount of sugar that's absorbed by the body and distributed to adipose tissues. However, traditionally with modern food, because sugar is consumed and absorbed higher up in the digestive system, downstream bacteria, which convert these sugars into fatty acids, are generally starved, which creates a lot of gut health issues. And so the benefit of our product is not only we're depriving calorically the body because they're trapped within the particles, but there's still some amount of sugar from these particles that's bioavailable for gut bacteria downstream. And so those downstream bacteria, counterintuitively, actually receive more of the carbohydrate nutrients that they need to generate short chain fatty acids. But the rest that's not absorbed by the body or consumed by gut bacteria are naturally removed from the body. And that's the mechanism of action for caloric deprivation.
Question from Meg. What distinguishes you from your competitors, and can you elaborate any more on your intellectual property?
There's certain elements just because they're patent pending or under trade secrets that we can't dive too deep into. But as I alluded to before, the core differentiators are twofold. The first is the breadth of the product's efficacy in terms of not only it being a caloric deprivator through more natural fibrous means, but also through the mechanism I just explained, promoting gut health by generating short chain fatty acids. That's one differentiator. It accomplishes both. The second is the degree of efficacy, which again has been demonstrated in vitro physiological-like conditions, but still need clinical trials to demonstrate in vivo efficacy. And so if that thesis plays out, and we have high confidence it will, then the second and perhaps more important differentiator will be that most products that are currently on the market aren't particularly effective at depriving calories, whereas ours would be, and would be in a way that promotes gut health through the generation of short chain fatty acids.
Thanks, Lance. We got the questions rolling in. So a couple of questions here from Chaz. Any information you guys can provide on dose/response, and in that, really thinking about the relationship with the quantity of the absorbent ingested and the quantity of the carbohydrate fat absorbed. So the sort of the ratio between how much you consume of the actual of your guys' product and how much that consumes of fat and sugar on a ratio basis. And how do you control so that some of the carbohydrates or sugars is actually metabolized versus absorbed and eliminated?
Great questions. So in vitro conditions, and in vitro is the key until we have clinical data, the ratio for sugars specifically is 6:1 on a weight basis. So what that means is per gram of our material that's ingested, 6 grams of sugar are absorbed into the material and eliminated. And so obviously physiological conditions can be very different in terms of pH, in terms of other compounds that are present, in terms of just mechanism of action. But even when you replicate some of those in vitro, pH, presence of gut bacteria, you still see this level of efficacy. To answer the second question, how do you make some amount of the carbohydrates bioavailable? That just happens naturally. It's a porous material, so there is an exchange with the stomach fluid solution that allows for the exchange of these sugars in and out of the porous material. And that's how the gut bacteria are fed downstream. Once the material is passing through the intestine, there will still be an exchange between the solution and the sugars trapped in the particles. Some of those sugars will naturally either be at the surface or transfer from the particle to solution where they could be metabolized by bacteria. But the key innovation here is not only just the deprivation aspect for absorption of the sugars by adipose, but it's also that this fibrous content has a more smoothing effect. And by that, I mean, instead of basically a ton of sugar just being absorbed, very quickly after it enters the digestive system by human cells and tissue, you allow some absorption by human cells and tissue, but you also save some of that material to be then metabolized by gut microbes. And that's where the duality of our product comes in both caloric deprivation and gut health.
Got it. That's kind of leads to a good point here. So the next question from Chaz is, how do you know if the bound carbohydrate is available to the gut microbiome, or how much of it would be available, considering that there are some carbohydrates that may not be available to microbes in the gut?
Yeah, there are a few ways to test that. An indirect, but probably the most important one is you can measure the production of metabolites. So by that, I mean, these carbohydrates are being metabolized by the gut microbes into these fatty acids, acetate, propionate, butyrate. And you can measure basically that metabolism versus a control, as we did, and demonstrate that more of those metabolites are generated in the presence of our product. And so the implication there, through indirect observation, is that more carbohydrates were available within the intestine for metabolism by these gut microbes, because those carbohydrates weren't just mostly absorbed early on in the stomach and duodenum.
Got it. Question here from Kent. Can you provide any information around the pricing or anticipated pricing of the product?
Not at this moment, just because a lot of that will depend on the degree of clinical efficacy as well as the product form factor. I can largely lay out the framework that we'll use, which is pretty common, which is that initially it'll be for sustainability reasons targeted towards areas of the market with higher willingness to pay for the product. But over time, because our mission isn't to just serve privileged populations, we want to provide wide, broad, affordable access to our product throughout the market. Once we're able to scale up and get costs of production down, we're able to lower the cost of our product to a degree where it's able to address a broader market that might have a lower willingness to pay, but still has a high interest in consuming our product.
Got it. A few more here. Chris has a couple questions. One, do the hydrogels change the viscosity of stomach content? And as such impact the secretion of acid in the stomach? Or do you guys know that yet?
So some of that data is proprietary. Some of it also we don't know in, again, true physiological conditions in vivo, because those tests are forthcoming. In vitro environments where there are stomach acids present, there's not a noticeable endurable change of viscosity, largely because it's not a large amount of content necessarily being absorbed. So it's not extremely different from the viscosity you would at least observe when taking a natural fiber, for example.
Okay. Question here from Jonathan. What sort of clinical trial design are you contemplating? And is there a reasonable placebo construct that does or does not absorb that would allow for a randomized design? And what would an endpoint look like there?
In terms of clinical tests, at a very high level, the key elements we're trying to test for are the caloric deprivation aspect, the metabolite production and microbiome health aspect. And so a lot of those tests will be, and also related to caloric deprivation, subsequent durable weight loss. And so for caloric deprivation, a lot of the clinical tests will be pretty simple, where you measure the calories in fecal content, essentially, versus the control. In terms of weight loss, again, over a period of time with product and control, you measure the duration and degree of weight loss. And for microbiome health, a lot of that will be metabolite monitoring, production monitoring, but also other metrics of gut health. In terms of control design, can't speak at this moment in terms of specifics, but largely what it'll look like is control group, either it's going to rely on just a traditional modern meal versus a modern meal ingested with our product. That would be the most natural control for demonstrating the degree of efficacy. Also possible to introduce as controls other products on the market that are either over the counter or are broadly consumed to demonstrate that compared to these already high priced products, we have more efficacy and maybe our price at a similar or even lower point.
Well, Lance, I have one last question. Well, two questions. One, just curious how you and the company have thought about the incorporation of BioLumen into other potential food products, beyond it being a supplement. Do you have an understanding of how this works alongside in actual food science and how this might behave from a product perspective?
It's a great question. Depending on the product, yes, have a preliminary sense, but it's of course incredibly important when you are an ingredient, one of several that's interacting in a product, that you meet the taste, texture, nutritional requirements of that product and don't disrupt it. And so let's take, for example, a nutritional bar. We want to be able to add enough of the product where it's still profitable in terms of percent content and the price that we're charging, but is affordable to the consumer. And from a functional standpoint, the bar, doesn't dissolve, break apart, doesn't have a, strange taste, doesn't, have the right texture. Those are all important for, changing people's behavior without changing people's outcomes in terms of health without changing their behavior. Basically letting them eat, junk food nutritional bars, but it being an actual promoter of health. In terms of another market aspect we're thinking through is on the topic of being an ingredient is D2C or even B2C versus being an ingredient provider that's B2B. And we pretty strongly feel that we want to have a direct relationship with our customers and want to go the B2C route, regardless of the form of our product. On the business side, part of that is about margin compression, but more importantly, it's about fostering this direct relationship and being able to have access to a rich suite of customer data and to really see how customers are interacting with the product, how this product is impacting their health, their wellness, their happiness, and being able to incorporate that into subsequent iterations of our product. And you can't necessarily get that rich data if you're relying on a B2B partnership where there's not a data sharing agreement in place.
Well, Lance, you're doing a good job answering all our questions. The last one I have is, what can the audience do to help you out today?
Yeah, as I mentioned, would love for anyone who's frankly just interested in learning more or potentially getting involved or connecting to discuss further to email me at the displayed email. In terms of specifics, as I mentioned, a large part of our focus currently is on conducting these clinical trials to demonstrate the efficacy of our product in actual people versus in vitro systems. And so if anyone has connections to clinical trial providers or clinical testing providers rather, who have expertise in microbiome, in caloric deprivation, and are able to quickly recruit populations and quickly conduct these studies in a fast but effective manner, would love to talk to you. On the other side, as I mentioned, D2C is an important channel for us and the primary way that we're going to market. And so if anyone has deep market expertise in terms of building out the direct consumer channel and how to market and appropriately target customers, would love to have conversations as well. We certainly have our hypotheses and structure we're taking, but we love to incorporate new feedback and data.
Great. Well, Lance and Paolo, thank you both so much for joining us today, and congratulations on all the progress to date. I'd also like to thank the audience for all of your thoughtful questions and for your active participation. For anybody who's new to Agrifood Conversations today, we host these calls every week on Thursdays at 3 p.m. Central Time. And you can register for Agrifood Conversations by going to agrifoodconversations.com. If you know somebody who'd like to watch this webinar, it'll be available on replay, and you can share it with them directly. I think a copy will be sent to your inbox, but you can also just have them register at agrifoodconversations.com, and they'll be able to access that inside of 24 hours. But otherwise, thank you, BioLumen. Thanks to our audience today, and we look forward to seeing you not next week because of Thanksgiving, but the week after.
Thank you, David, and thank you everyone who attended this talk.